Hello, dear fellow countrymen, dear viewers of our channel. Today, we will talk with you about newly diagnosed diabetes. So, diabetes has been detected if the blood sugar level rises and after fasting it is 7 or higher, or after eating it is 11 or higher, then a diagnosis of diabetes can be made. Diabetes is considered newly diagnosed if it has been detected within the last 3 months. So, what is the approach here? If there is suspicion that the patient's pancreatic secretion, that is, insulin secretion, is decreasing or has stopped, or if the trend is towards a decrease, then if there is an insulin deficiency, insulin therapy should be administered. However, in more than 90% of cases, these patients still retain pancreatic insulin production. Often, the pancreas is actually producing a very large amount of insulin. If patients are producing a lot of insulin, then why is their blood sugar still increasing? This question naturally arises. To answer this question, I can say following. It concerns insulin resistance. We talked about insulin resistance last time as well. This condition is called insulin resistance. In other words, there is insulin, there is a lot of insulin, but it is not producing its biological effect, meaning it is not lowering the blood sugar level. It is not fully performing its function. This is the state of insulin resistance, the condition of insulin resistance. The signs of insulin resistance, these are the signs. First of all, excess weight, when the waist circumference is more than 94 centimeters in men and more than 80 centimeters in women. That is, if a patient starts to have elevated blood sugar levels and their waist circumference is 100 or 107 centimeters in men, or 100 or 120 centimeters in women. What does this indicate? Insulin secretion is not impaired. There is a lot of insulin, there is insulin resistance. In other words, even though there is a lot of insulin, it is not performing its function. In this situation, there is insulin resistance. It is necessary to identify the cause of the insulin resistance. Is it due to excess weight, a vitamin deficiency, or a deficiency of sex hormones? Whether in men or women, it is absolutely necessary to determine the presence of sarcopenia. At the very beginning, even patients with conditions like this can be effectively treated without the need for blood sugar lowering tablets. In other words, a state of clinical remission can be successfully achieved. The patient does not take blood sugar lowering medications and their blood sugar level does not exceed the normal range. It's called clinical remission, meaning the disappearance of symptoms of the disease, as we can now tell from the patient's conversation with the patient. Peace be upon you, Rahim. Shelf. My brother Ratim John, you came to our clinic on November 11th. You came on November 11th. After 7 years of fasting and 31 meals, it turned out to be 16 years.
Is that correct?
So, how long has it been since your blood sugar started to rise like this? How long has your blood sugar level been increasing?
These 2 or 3 months have passed by. I don't remember.
What symptoms did you have at that time? Dry mouth, thirst and pain in other areas. What complaints did you have back then?
It was mainly dry mouth at first, dry mouth and feeling weak. I even wanted to sleep a lot, felt sleepy all the time. Then I went to the doctor and after the examination, they made that diagnosis. They confirmed it. Then, on a friend's advice, I came here for the next step. You've seen me several times over the past month and a half, and there have been changes. In my opinion, it's been extremely good.
So, dear Rahim John, when you first came to us, we thoroughly examined you and your condition. How much insulin is being produced by the pancreas? How well is the pancreas functioning? It turns out insulin is being produced and there is plenty of insulin. If there is a lot of insulin, if insulin is sufficient, I wondered why the blood sugar level increases. While investigating the cause of increased blood sugar, for example, a deficiency of skeletal muscles was detected during bioimpedance analysis. It turned out that the body is lacking almost 6 kilos of muscle, and there isn't an excess of 16 or 17 kilos of fat in the body. If you should have 4 kilos according to the standard, here it turned out there is a deficit of 27 kilos. Testosterone levels had dropped and vitamin levels were low. He gave you medications to correct these issues. He prescribed a diet and exercise. So, how are you feeling now?
Right now, as of today, I feel much better. In the morning, I get up early and walk 2 or 3 kilometers, and throughout the day, I walk about 10 kilometers. On average, it's 8 kilometers, and even on days when I walk the least, it's at least 5 kilometers.
When you arrived, we didn't give you any medication to lower your blood sugar, right?
Yes.
You were given vitamins, testosterone was considered, and alpha lipoic acid was prescribed. So, what kind of condition was it? How did it go? What changes have there been dynamically? So, what's your blood sugar today? Today, your blood sugar level came out to be 5.9 on your test, right? After eating, it was 5.7. Right now, you're not taking any medication to lower your blood sugar, are you? You're not using insulin, right?
No, I haven't taken any medication at all.
This remarkable event happened within just one short month.
That's the result.
The result. What aren't you eating? For example, what have you given up? From food, I've stopped eating pilaf, heavy stews, lamb, fatty pot dishes. I've cut out pilaf completely. And if pilaf was served 3 times, I would eat it 3 times. I really love pilaf, actually. Now I realize how important it is to think about your health.
I haven't eaten lamb for a month now. I don't touch cardamom or any of those heavy dishes at all anymore. As for sweets, I hardly eat them anymore, and I avoid all carbonated drinks and sugary foods, none of that now. Every now and then, maybe just once in a while, but honestly, I haven't even had cola or Fanta yet. If I do have one, I make sure to balance it out.
I avoid carbonated drinks, just drink regular water, and I drink green tea. Isn't the diet difficult for you?
No. Of course, everything is difficult at first, but if you think about your health, nothing is really that hard. I eat a lot of greens, a lot of salads. I eat an incredible amount of salad, all kinds of salads. Salads with cucumbers and tomatoes, I eat a lot of them when I get bored. Radishes, turnips, these kinds of foods I eat every day.
Now, for example, this morning it was 5 to 9, and before that it was 5 to 7. After lunch it was 5 to 7, and sometimes it went up to 6 to 4. This is the result for 1 month now. Now, what we need to determine is, after 3 months, we should see how much your glycated hemoglobin has decreased, or the average level of glycated hemoglobin measured over the last 3 to 4 months is almost precisely the same as the total amount of sugar you've had circulating within your system during that entire period. At the end of 3 months, it was 7.5, and after 3 months, we will check how much it has changed, how your deficiencies or the excess fat in your body have decreased. This will be the first stage. After that, if your blood sugar level does not increase without taking sugar-lowering medication, this is called clinical remission. It is considered corrected. In the next stage, the goal is to help you maintain your blood sugar level without increasing it for the rest of your life as much as possible. Thank you.
Take care.
In summary, if insulin production from the pancreas is not impaired, if insulin is produced in sufficient amounts, if there is sensitivity to insulin, and if the causes of insulin resistance are eliminated, it is possible to overcome diabetes. Subscribe to our channel to stay updated with the latest news. Like and share on social media so that our fellow countrymen who are searching for a cure for their illness or whose close relatives have recently been diagnosed with diabetes can be informed.